This is Chapter 5 Neuro, and in this video we'll be discussing the drug class benzodiazepines. So benzodiazepines are known as sedative hypnotics. So the only difference between a sedative and a hypnotic is the dosing. So drugs are sedatives at lower doses, and they are considered hypnotics at higher doses. So before we had benzodiazepines for sedation and the use of hypnotics, we used to prefer the drug class called barbiturates, but those have really fallen out of favor. Barbiturates were known for causing a lot of respiratory depression because they were infinitely able to depress the central nervous system. So they had a pretty high risk of suicide, and it didn't take a lot of medication to overdose and lose the ability to breathe. They were also high risk for abuse, and they had a lot of drug-drug interactions through the liver and different enzymes that metabolize drugs. So now benzodiazepines are a lot better, and we use them a lot more often because they only have a finite ability to depress the central nervous system, so there's less of a chance for that respiratory depression, so it makes them a little bit safer, and there are a lot less drug-drug interactions. So today we typically use benzodiazepines for anxiety and insomnia. None of the medications we'll discuss today have the indication for insomnia, but they can be used for that. And so the different reasons that we pick the different benzodiazepines is typically for the duration of action needed. So short-acting benzodiazepines last between 1 and 12 hours, and they can be used for panic attacks or for seizures that are known as status epilepticus. The medium or intermediate acting benzodiazepines can work for between 12 and 40 hours, and those can be used for anxiety, insomnia, panic disorder, and as well as seizures. The long-acting benzodiazepines can work from 40 to 250 hours and can be used for alcohol withdrawal, among other things. So the 4 benzodiazepines we'll discuss today are Alprazolam, with the brand name Xanax, Midazolam or Versed, Clonazepam or Klonopin, and Lorazepam or Ativan. So we can remember that these are benzodiazepines by their stem, either the azolam stem or the azepam stem. So now we'll go over 5 practice questions. So the first practice question is a benzodiazepine that is metabolized by the liver is. And so for the remaining questions, A will be Alprazolam, B will be Midazolam, C will be Clonazepam, and D will be Lorazepam. So the correct answer is D, Lorazepam. So Lorazepam is metabolized by the liver. So there's 3 different benzodiazepines that are metabolized by the liver, and we can remember them as LOT, and so it is Lorazepam, oxazepam, and temazepam. And the rest are metabolized by the kidneys. So a reason we might prefer a drug that is metabolized by the liver is because in certain patients, especially the elderly population, they are more likely to have renal impairment and worse kidneys. So in patients that are older, it would take longer to clear the drug, and so we might have more of a sedative effect in those patients. So that's when we might consider using a medication that's cleared by the liver instead. So Lorazepam is an intermediate acting benzodiazepine, and we can use it for alcohol withdrawal and anxiety, as well as seizure disorders. So for the next 3 questions, we'll have the same answers in the same order, and we'll just change the question to make the answer correct. So the next question, make A correct. A benzodiazepine that is intermediate acting and available as an oral solution is, and the answer is A, Alprazolam. Alprazolam is pretty cool, and it has quite a few different dosage forms, so we can have an extended release tablet, a disintegrating tablet for those who can't swallow, as well as a solution for those who can't swallow pills. Midazolam is short-acting, so that's not correct. And clonazepam and lorazepam are both intermediate-acting, but clonazepam is only available as a tablet, and lorazepam does have some different dosage forms, namely one that can be injected, but it is not available as a solution. And we typically use alprazolam for anxiety disorders and panic disorders. So question 3, make B correct. A benzodiazepine that is short-acting and can cause anti-retrograde amnesia is, and the answer is B, midazolam. So A, B, A, C, and D are incorrect because they're all intermediate acting. And while all of these benzodiazepines can be associated with the amnesia, midazolam is pretty well known for causing this. So anti-retrograde amnesia, anti means before, so you can think of it as maybe the ante in poker that you bet before the dealer deals. And so anti-retrograde amnesia just means that after you take the medication, you are unable to form new memories. So if you do things shortly after taking the medication, you might not remember that you did them. So midazolam can also be used in the hospital especially for sedation procedures, like when we're intubating someone. So question 4, make C correct. A benzodiazepine that is used for seizures is, and select all that apply. And so the correct answer is C, clonazepam, and D, lorazepam. So those are both indicated for seizures, especially for the status epilepticus. So A is incorrect. Alprazolam is only indicated for anxiety, and B, midazolam is incorrect because it is used for anxiety and also induction of anesthesia.